we're going to talk about the all-important, complicating topic of the use of cannabis in people with cancer. The reason that it's complicated is that cancer is complicated, and it's definitely not something that someone should self-treat with cannabis. However, the most common things that happen with cancer patients and cannabis is that it's used to treat symptoms that are difficult for cancer patients to handle, such as low appetite, possibly as a result of chemotherapy, such as nausea, possibly as a result of chemotherapy. So for all of these different symptoms, we have special condition sections where you should refer to how to use cannabis for pain, etc. But as far as the cancer itself, there are many people who call me and want to know, how do I use cannabis to actually treat my cancer? And I tell every single one of them, you should not do this unsupervised. There are many reasons you shouldn't do it unsupervised. The most important one being, don't stop your regular cancer therapy and replace it with cannabis. That's highly inadvisable. If you want to use cannabis to add to your cancer regulating therapy, then you have to use really high doses. Again, don't do it unsupervised. But it has been found that sometimes you can use concentrated cannabis oil to shrink tumors. You may read about it, on YouTube or hear friends talk about it. It is possible, but you have to know what to use, how much to use, and you have to stick with it for a really long time. So it's not a lightly undertaken therapy. And hopefully, as time goes on, your oncologist may become more knowledgeable about how to add cannabis therapy into your protocol.